So watching this TikTok video of this doctor saying that degeneration is normal, we should stop telling people that they are degenerating and that there's an issue with that. Well, I can tell you right now that he is completely and 100% wrong. He has no idea what he's talking about. I'd really like to see what his credentials are in biomechanics and degeneration, what his postdoctoral training is, because what he doesn't understand is there are things called the gating mechanism. There are things called Wolff's Law that actually go through how your body degenerates due to abnormal weight bearing and movement patterns. This has actually been scientifically proven through the research, through all of the literature. No one's debating this except for this person. So for him to say that all of that is untrue just tells me how little training he really has. And I really hope that he is not treating patients that have these conditions, because he clearly has no idea what's going on with them. The biggest thing is that when we have degenerative disc disease, it's called degenerative disc disease. I mean, it clearly is a degenerative factor. It is not a normal type of aging. The problem that people have is they confuse the words normal and common. Just because something is common does not mean that it's normal to have. Just like it's common to have someone stub their toe does not mean that it's normal to have pain in your toe from you stubbing it. Those are two different things. It's a very common injury to have, but it's not normal to have any kind of injury. And the other thing too is that saying that it's normal means that everyone whose ages has that happen, that it would be abnormal to not see degeneration in a person. Well, then I would ask, why are we seeing osteoarthritis in someone who's 12 to 15 years old after an injury that happened 3 years prior because of permanent damage that they had done? If it was a normal part of aging, I would expect to see that only in people at specific age groups, not in those post-trauma after they have gone through and had permanency dealing with their injury. So the whole thing he's doing makes no sense. He's clearly doing this just for clicks. He's not following the actual science and the literature. This is exactly why I always say that when you have an accident, injury, or trauma, you should make sure you go to doctors who are actually qualified, who have the backing and the qualifications and all of the training that's going to need to be able to not only diagnose you properly, but treat you properly too. Because this person should definitely not be handling anyone who has been in any major accidents, injuries, or traumas, and he can stick with more wellness type care if he is actually licensed to do that.